I have to admit, my discomfort went so high because I like to be unsung. It's not about me, it's about all that we do and the impact that we make. And it's very personal. So I'm a nurse first, long before I was a chief executive. And I think that's a great foundation for working in not only nonprofits, but in healthcare in leadership positions, because nurses, as a general rule, have empathy, they listen, they are in touch with their patients, and they never take their eye off patients.
Welcome to the Oxygen Coaching Group 2023 Women in Business podcast series. We are so excited to highlight this year's Women in Business and all that they're doing for our community. Hope you enjoy the series.
Hi, Oxygen community. Okay, I have to tell you that this is one of the podcasts that I think we've planned for the longest period of time ever. And I am so excited to bring to you. We've been trying to plan this one for, I want to say 3 years. So the content you're going to get today is so incredibly worth the listen to. Let me introduce you to Stephanie Wiersma from Lorain County Health and Dental. And she is full of nonprofit information and comes to this podcast so well recommended. So Stephanie, welcome to the Oxygen podcast.
Thank you, Kat. I'm so happy to join you. And yes, it's been a long time in the planning. You're right.
That means it's going to be well worth it. So I'm excited. All right. So tell us a little bit. So one of the things that makes our conversation today unique is the type of organization that you are running. So tell the community a little bit about what you do and about Lorain County Health and Dentistry.
Sure, thank you. So Lorain County Health and Dentistry is a community health center. It's technically called a federally qualified health center. It's a lot of words, I know, but we're a nonprofit charitable organization, a 501c3. Our mission is to provide primary and preventive health care, so medical, dental, eye, behavioral health, podiatry, OBGYN to all persons, but we specifically seek to serve those who would not have access to healthcare because of lack of insurance. They may be underinsured. They may not know where to go, and they may be living some distance away from providers and don't have transportation. So in a nutshell, that's what we do. We're the largest safety net provider of primary care in Lorain County.
I love this. All right. So the reason why Stephanie was brought to me as someone to highlight in our Women in Business series is because she is a little bit of an unsung hero. And I love to find women like you that people don't necessarily give enough kudos to. So I want to bring attention to the fact that you were kind of called upon to start this mission way back when Lorain County Health was segmented. And my understanding is, and you can correct me if I'm wrong here a little bit, but you were given this funding to provide healthcare for maybe the under or uninsured. And then one day it was just taken out from underneath you. So being the fierce warrior woman you are, you went and in a matter of just 30 days made freaking amazing things happen. So first of all, tell me a little bit about that journey and what drives you to be that type of entrepreneur, kind of that entrepreneurial spirit, because you could have very easily walked away. And then tell me about what that feels like to accomplish in a very short period of time, something that most people won't ever accomplish in their entire lives.
Well, thank you. I that's a lot you just asked me to tell you about, and I am so happy to, but I have to admit my discomfort went so high because I like to be unsung. It's not about me. It's about all that we do and the impact that we make. And it's It's very personal. So I'm a nurse first, long before I was a chief executive. And I think that's a great foundation for working in not only nonprofits, but in healthcare, in leadership positions, because nurses, as a general rule, have empathy, they listen, they are in touch with their patients, and they never take their eye off patients. And that probably is the strongest lesson that I took with me. So I've been a nurse for more than 35 years now, and always in Lorain County. And the nonprofit Lorain County Health and Dentistry has its roots in a hospital department. Hospital's long gone now. Healthcare has changed quite a bit in Lorain County and across the country, of course. But at the time, 22 years ago, the department of the hospital that was providing some primary care, no dental, no vision, no behavioral health, nothing like that, but just some kind of meat and potatoes primary care, had fallen on hard times. And the hospital wanted to have it continue, but didn't want to keep funding it. It was losing millions of dollars a year. So I think about chance and why people do things and how you don't know why you do things. But one day I remember walking in the hallway of the hospital where I had worked in leadership, loved my job, loved the people I worked with. I saw a job posting for a different leadership position. And frankly, it didn't say chief executive. It said director of, it might have been called the Family Care Center back then. Whatever it was, it would have been a parallel move. And I was just interested enough that I sat for an interview, and next thing you know, I was interviewing with the chief executive of the hospital, and I was finding out more about what a federally qualified health center could do for the community. And so I ended up getting the job. And honestly, my first task was to unemploy myself from the hospital. So after 18 years, I was no longer employed, and I was the first employee of, and the only employee of the new organization once it got established and organized as a charitable organization and all. So that was kind of a leap of faith. And
Amen.
Nothing makes you work harder, right? When you leave a comfort zone and you take on something and say, I'm all in. If I wasn't all in, I'm sure I wouldn't be talking to you today. And so, we took on debt that the hospital department had. We were not federally qualified then. And frankly, we didn't get federal money for a number of years, Kat. But we had some benefits that helped us in our billing and collecting, frankly, because we're not a free clinic. We're not volunteers. We're all paid market wages. So the doctors and dentists I employ, I compete with the big systems, if you will, to get the best of the best. But then they have to have that added community gene, as I say, that gene for compassion that's above and beyond what you might see in big systems. So nonetheless, we were able to chart a course and stay true to a mission to provide this healthcare to those most in need, even with few dollars. And I'll never forget, the hospital had agreed to subsidize us for a period of time until we broke even. And I think they expected it would go a little quicker, but frankly, digging yourself out of a $3 million debt, that was a lot for a small organization that was new. Not to mention new leadership, but this was my first foray into being an executive. Nonetheless, I got a call from the chief executive of the hospital at the time at 4:30. This is one of those transformational moments, right? And he said to me, Stephanie, I just want you to know that you're probably going to get a call from the press tomorrow. I said, okay, why is that? Because I called a press conference and we're not going to be able to fund you anymore you meaning the health center, and we're not going to be able to fund. And he named a number of other entities in the community that, and this is because they just didn't have the means. It was a tough time in this hospital's existence, if you will. And so I said, okay, thank you very much. And I thought about it all night. And honestly, whoever said, the crisis, take advantage of the crisis. And I did. And I told the reporter, because he called me by 8:30, and I said, well, the health center may close. And that was the headline in the paper the next day: the health center may close. So what that did for me was to rally not just my staff, but all of the people who relied on us to get health care. And we were just a much smaller organization than we are today, with just 2 sites. And it started with a clipboard and some paper. And I asked my staff to ask every patient to write a letter, write their words. What would happen if the health center closed? What would you do? And Kat, that is volume number 1 of 18 volumes of patient letters, I call them, in the words of our patients, that we have collected over the years. And nothing is more inspiring to me than to read the impact and to hear the impact of the work of my staff, and how important. There wasn't a choice. We could never close. And of course, we never did. We had some hard times, though.
So, well, I've learned this lesson. One day I'm actually going to follow it, to start recording as soon as everybody enters the podcast room, because some of the things that we talk about before the podcast even starts is literally the things that we should be recording.
Yeah.
And we were talking about one of the things at Oxygen that makes us unique is we are not business from a book. We are business in the trenches.
Yeah.
And what you just told me is literally business in the trenches. You didn't go to business school, you went to nursing school.
Exactly. You're right. It is business in the trenches.
Yeah, I have goosebumps. I you probably could see them on my arms. I mean, I cannot. This is why it took us 3 years to mesh our schedules and put you in front of this audience. There are so many, I can't, like, my notes, like, I can't scribble fast enough to make sure we loop back and talk about all of the things that came out of the first question I asked you.
I'm sorry.
No, you're so fantastic. I mean, and this is why I said I don't know that there are enough people. So let me read this to you. So the chairman of your board says she has created something that is unbelievable. No one matches what we run in the US. Statistically, there are 1,403 HQHCs in the US with 15,308 service sites.
Yep.
Which you guys have multiple service sites in your system. Where you talk about being $3 million in debt, you now on public record have $11 million in the bank and have had multiple audits with 0 findings.
Yep.
This is not a woman who is BSing you folks. She literally had everything taken from her. And in a day where social media wasn't a thing, like this wasn't, she's literally talking about the newspaper. Like this is not something that goes viral.
You're right. You know what, Kat, I have to tell you, also at that same time, and that was back in 2006 or so, I had a patient come up to me. I didn't know the person, had never met her. And she said, do you mind if I create a petition? Because I'd like to go around the neighborhood so that we can get the attention of the mayor, and he'll never let you close, or something like that. And I thought, bingo, why didn't I think of that? So quickly put together a petition, and God bless her, gave her a clipboard, and she walked the neighborhoods near our health center in Lorraine. And I don't recall how many signatures she got. And by the way, the city doesn't fund us. We don't get any city or county money. It's just in our name. It's geographic. But that's okay. The idea was to get the word out to as many people, right? That the health center may close and it would be a very bad thing for the community. So God bless her. Her first name was Christine. Christine walked the neighborhood, brought me back pages and pages and pages of signatures. And I scheduled a meeting with the mayor, the Lorain mayor at the time. And again, he wasn't really going to give us any money. I didn't have any, sense that he would, but I brought the signatures and I brought the letters. I had probably hundreds of them by then. And he went through the signatures. I mean, he didn't know what to say. And he went, "Oh my God, that's my aunt. Oh my word, that's my," and he knew the people, and it just highlighted to him that, there probably is this jewel in the city that maybe I need to learn a little more about. And he's moved on. It's been several mayors ago, but I guess it's to your point. Quiet things are going on, and I like being unsung. I'm uncomfortable doing this because it's not about me, and I didn't do it alone. I have a spectacular team, and we all work together. But in the end, the letters have become part of who we are. I mentioned we have 18 volumes. It might be, I think we actually have a 19th that we just haven't bound yet. But I meet with every new employee during orientation, and I tell providers, our physicians and dentists, hey, when you have a bad day, let me know, because all you have to do is open one of these books of letters and you will be reminded why you do the work you do and why working so hard brings so much back to you. In the end of the day, your gas tank is filled because you made a difference, and someone else couldn't have made that difference in the same way.
You have an amazing leadership style, and obviously the give forward mentality that you carry goes way beyond being a nurse. And I think it's amazing to just soak in the things that you are putting out in the world. I want to circle back to a couple things that you said here, because for those that are listening as a part of the Women in Business series, I think that there's a lot of pressure on people to constantly be climbing a ladder. And that could be a whole nother topic. But one of the things that you said while we were talking just now was that you assumed that you were making a lateral move when you made this transition, but there's something in this that just called to you. And I think that whether you're an owner or a leader or just a woman in out there trying to decide what the next thing is, it's really important for us to be out there talking about the fact that it's okay if a lateral move is what you think is right, because you never know where it might lead you. And interestingly enough, you are leading women. We're going to talk about your team here in just a minute.
Okay.
But women as a whole, that it's okay to take a lateral move. It's okay to maybe even step down because it's the right time for you, and I love that you say that out loud. Like, hey, by the way, this was a lateral move for me, and now this is where I'm at.
Yeah, it's true. It's true. Sometimes we're the hardest on ourselves, right? And I think that being willing to be open to opportunity, and it presents itself in all kinds of different packages, right? I know timing is very important. And for me, that time in my life was a good time to take on something. Having a support system is also really important. And I see it with my staff. And we're obviously a support system to our staff members. But yes, I would suggest be willing to see beyond what's right in front of you. I do think having the ability to kind of look into the future, establish a vision, And I say to my team, we do have one. Our board has established a mission, a vision, and of course values. And my job is to keep at least one eye on that vision of all time at all times, so that the ship is going in the right direction. And I feel like that's a personal thing too. And not just for women, for anyone. No, see beyond, and don't be afraid to do the hard work. And frankly, you know, there's so much value in the hard work and the pitfalls and the trenches, however you want to say it. I think, Kat, of all the times that this should have failed, it should not have been successful, but it is. And the future, there'll be a health center organization here for 100 years to come. I guarantee it, because people trust us. We fill a need. We have great clinical outcomes. Our patient satisfaction is off the charts. It doesn't mean it's easy. It's not. It's hard. But I'm just setting the stage for it, and the door is open for others in the future to do this work and to do similar work. And I'd say follow your heart, and if you think you might want to try it, gosh, try it by all means.
Well, ironically, when I interviewed the chairman of your board, he also said that you are leaving a legacy behind you that many will benefit from. So he's very complimentary of you. Let's talk about what you're doing in terms of recruitment. So right now, the majority of your management team is female,
right?
And that is unique. That is unique in healthcare. That is unique in most industries. Tell me what makes that possible for you and why that is an advantage over other leadership teams.
So first of all, I will say this, we're an organization of about 112 employees, and we have maybe 12 or 15 openings that we're interviewing for now, let's say. But my management team, my senior leadership team, is predominantly women. In healthcare, that's not terribly unusual, particularly in nursing, because it's largely been a female profession. I will say I have been blessed to find very strong candidates, and you know what? I don't care if they're female or male. It doesn't matter to me. I want to find the person who has the best skill set, but way beyond that, is committed to community, because that's, we are of the community. We're not from it. We are just of it. We came out of the earth almost. That's that trench thing again, isn't it? But we really did. And so I'll look for, and I've been really fortunate over the years to bring aboard some strong women who had never heard of a federally qualified health center before, who may have had positions in banking or in public accounting, or in mental health agencies outside of, that aren't private, if you will, that are more a public model. I've seen and encouraged and supported women who, one in particular that I can think of on my team, who went back to school in the middle of the pandemic, had a full-time job, but went back to school to become an RN because she was so committed to the work she was doing and felt that she could do more. So leaving work at 5 o'clock and going to night classes for a nursing degree. And when that happens, when one person does that, it inspires everybody on the team. Everybody rallies around, and we all. I don't have any qualms about or concerns about the depth of my leadership team whatsoever. I have 3 men out of 9 of us. There are 3 men on my team, and they are also equally committed and devoted to the organization. And that's, to me, that's the most important. They need to be committed to the organization and the mission. It's not to me personally, it's to the organization. And
when we were, go ahead.
I was going to say, when you have that, you know it, right? So I can step out of the picture and they're still carrying the water, if you will.
Yeah, it's interesting to me too when we were talking before your interview about your recruiting of new doctors as well. And you even mentioned it when you were originally talking. You're competing against the best of the best in these big systems, and doctors really have a unique opportunity to come and work not only with a demographic and some of the amazing growth opportunities that you have, but like they're not working on the weekends, they're not on call, they're not supporting a hospital, but then this amazing leadership team that is thinking outside the box. Like you had mentioned, you've got behavioral health coming on board, you've got all of the pharmacy pieces that are actually functioning on slide, like all of these amazing growth opportunities, and the doctors that you can get a hold of and really get to see working with this amazing management team. It really gives medical a different perspective.
I agree, it does. And honestly, I'm sure there are providers, whether they're doctors, dentists, nurse practitioners, that don't know that we exist and had not heard of a federally qualified health center or even community health. And that's one of the struggles when you're building something. It's hard to be in 2 places at one time, right? Like to be out in the community and kind of waving the flag and saying, hey, everybody, look over here because there's some great opportunities and you're going to love it. It just doesn't happen quite that way. We do have good connections and good, I'd say, relationships in the community with hospital systems that know our work, and I know they appreciate our work because we provide a service to that they may not want to provide. Frankly, we serve a lot of uninsured, we serve a lot of Medicaid. It's not your best payer by a long shot. To a federally qualified health center, though, we got a little bump up in pay for Medicaid. It's the government's way of incentivizing a little bit, but in the end, probably viewed by some as a competitor and not really a collaborator in that sense, because healthcare is a tough industry, and hospital systems, that's the pinnacle of tough. They are all vying for the same, population and to survive. And, I would never want to predict what healthcare will look like down the road. I am confident that community health centers will survive. We served, I think it was 31.5 million Americans last year. That's huge. And the folks in Congress pay attention to that number, and they pay attention, more importantly, to the clinical outcomes, the measures that we have to uniformly report that get kind of sucked right out of our electronic record system. So they see how well we care for diabetic patients and those with hypertension, and how well we, give immunizations to kids and adults, and do depression screens and all that sort of thing. So that data really tells the story. But, would it be a good idea for, med schools to include community health? I would love it. We do a lot of training. So we have nurse practitioners that come through that will be precepted by one of our nurse practitioner providers. And honestly, they will come back to us, some immediately, and say, do you have a job for me? I love it here. I love what I do. So you can feel it when you've got a staff that buys into the mission, and I do. It's palpable. People feel it. They know they're making a difference. And that's, paycheck's good. Don't get me wrong. We all have mortgages and we have car payments to make and all that sort of thing, and kids to take care of. But, in the end, there's a job, and then there's, and a career, and then there's what you really aspire to do, which is to inspire hope and make an impact on the health of the community and healthcare. I can't think of anything better than that, frankly.
Well, I am very confident that that's what you have got going on over there, because your
Yeah,
leadership does not lend for anything other than that. It's oozing out of you. So one of the things that you told me was that your initiative, one of the initiatives that you guys have set is to continue to offer services and lower the threshold for services to be available to the community. So I want to give you an opportunity to kind of
sure.
speak to that a little bit. I hinted at it a few minutes ago, but go ahead and tell us a little bit about the added services that you guys are bringing on. I know you guys have state-of-the-art equipment and are
You.
opening service centers. Like you guys are just expanding all over. I'm a long distance runner, for those of you who are new to this community or listening to this podcast, and I run by these buildings all the time, and they're brand new and they're beautiful.
That's
So
funny.
go ahead and speak to what you guys are working on and new things that are
Sure.
going on for people who are listening. How do they interact with you or become a patient? Obviously, they don't have to be uninsured. So give us a
No.
little bit of a temperature check on what that looks like and feels like for you guys at your organization.
Sure, thank you. Yeah, so Lorain County Health and Dentistry is a community health center, which means we serve the community, bottom line. But we do get some federal dollars, not a lot, but some, and that those dollars we must use to offset the cost of care for those folks that might be either uninsured or underinsured, or even if they're insured and they qualify based on federal poverty level and number of persons in the household. So we have posted slides. We have a financial associate whose job it is to help people to see what they qualify in terms of a slide. So those that qualify for a 100% discount we would ask for $20 at a medical visit and $35 at a dental visit. And if they can't pay it, we'll put it on an account and we'll ask them to bring in $10 more next time, but we don't turn anyone away and we don't go to collections and we don't, and that those federal dollars help to offset what we write off, frankly. And so it's a challenge because it's a population that may be not paying for their care, right? So we also see commercial insurances, all commercial insurances. So we're just like any other physician office or dentist office, if you will. And we bill and collect. We get paid the same as any other private provider would on those insurance contracts. And we bill and collect. And we do qualify as a nonprofit 501c3. There are some grant opportunities that we'll pursue. There are some local foundations that have been very good to us over the years, the Community Foundation of Lorain County and Nord Family Foundation. And years ago, the Stalker Foundation, when they were funding healthcare, those were really significant funders to us over the years. And so what our job is to close gaps, if you will, or to find the need that exists and find a way to meet that need. And so when we first started out, 22 years ago, we did not have any dentistry at all. It wasn't even on the radar. I didn't even like going to the dentist. It is just not my cup of tea, right? So I remember a health commissioner, long retired, approached me and said, Stephanie, you need to open a dental clinic. I said, there's no way we're opening a dental clinic. Yes, you do. You need to. Nope. And like you, Kat, and how you and I went back and forth for 3 years, I think I went back and forth with her for at least a year. And
now I know it's not just me.
It's not personal to you whatsoever. So the thing is, I did the research and I heard from others. And you know what? Oral health care, the number one most unmet need in the state of Ohio. Who knew?
Wow.
We can all go to a dentist if we have insurance, and hopefully everybody goes, for preventive work. But you still have an out of pocket. Certainly, if you need any service, you do, right?
Sure.
So
yeah.
imagine not having any insurance or having Medicaid, because Medicaid is it's a low payer. People were going to the ER with tooth pain, and they weren't getting it resolved because dentists don't work in an ER, right? And so fast forward, we determined to open a dental clinic, and it's another leap of faith. And now, over the years, we changed our name to put dentistry in our name because we felt so committed to it. And we recognize the impact of oral health care on the whole body health. And so that is one service, that one department I can tell you that it's a heavy equipment and supply department, if you will. It's much more costly than running a medical practice, or certainly behavioral health practice. And we have state-of-the-art equipment. When we interview dentists to work here, they're astounded at the equipment, and each of our 3 dental sites has the same equipment. We don't favor one or the other. So the folks in Elyria or Oberlin or Lorraine can get the same excellent access to top of the line radiography and all of the care that follows, from the treatment plan. It's just amazing. The most recent service we opened is pharmacy. We had been offering, as a federally qualified health center, we're recognized as a covered entity for what's called the reduced drug pricing program. In essence, we can purchase pharmaceuticals a lot cheaper than the average public, right? And so we had offered pharmacy since maybe 2010 through contracts, so Walgreens and Giant Eagle and Walmart and some other big chains. But we took another leap more recently and brought a pharmacy on site in a newly constructed health center in Elyria on Middle Avenue. And we just opened in July. And what's huge about it is, so for our patients that don't have pharmacy insurance, they get the benefit of the low cost prescriptions. So there's nothing worse for a provider than to order some medication for high blood pressure, for example, or diabetes, and the patient doesn't fill the prescription because they can't afford it. We're at a standstill. And so having a pharmacy that we operate, that we can set up to meet the specific needs of our patients, which really is the specific needs of the community, if you think about it, it's a wonderful thing. And so for those of our patients that don't live in Elyria, we offer free delivery to their home. So trying to eliminate that transportation barrier too.
I just think that everything that I've learned about this program, as I've prepared to talk to you today, you're really meeting the patient where they're at. And, having watched aging grandparents and having aging parents and a sick child, like all the different stages of life, I feel like I've had them all at this stage. Everybody has a different challenge, and, it's one thing when it's preventative, but even when you're not feeling well, nobody wants to have to go through the extra stages and you really encompass the whole patient, rather than expecting the patient to have to jump through the hoops, and sort it out. So frustrating.
You're right. We do. I think that it's so important. So not only is the care top of the line, I would match ours next to, name another provider, name another health system. We have the data to show, the evidence to show. You come to us and you're going to get the best care for hypertension. You're going to get top shelf care for diabetes or for tooth decay, you name it. But it's also that we're convenient, but it's more than that. People trust us. They trust us because we do what we say. I sometimes use the term meat and potatoes. People can relate to that. We're not fancy. We're not high gloss, shiny, but you said you jogged by our buildings. They look good. They're beautifully constructed. They are well equipped. They are clean. To me, that's the first piece of evidence that when you walk in, that you're going to get respect from my team, and you're going to get good health care, because that's what it starts with, right?
Yeah.
And that's so important to me. And, I'll say to one of my team members, hey, did you notice the parking lot? The wind blew some, and we know we need to get out there and pick up whatever the wind blew over. It's just a small thing, but it's important. People
Yeah,
need to know.
it's not small. It's all the things that really start to add up, and it's interesting listening to you have this conversation because like I said, we don't do a lot of nonprofit, we don't do a lot of medical on throughout the podcast. And there's so many parallels. Like it's uncanny having this conversation today. I mean, the empathy that it takes to the end user, caring about what people say, having testimonials. Can we simply just care about what the product looks like? Can we be top of the line? Can it be clean? Like, this is not rocket science. We are not talking about if you go to, and I will make this parallel, not in a very positive way. Like, do you want to shop at a grocery store that's dirty? No, you don't want to go to a doctor's office that's dirty.
No.
Like, I don't want to have an office building that's dirty. I mean, there are so many things that we take for granted. And as a leader, I see this all the time, Stephanie, and I think you are the living embodiment of this. As goes the leader, so goes the team. And you have set this bar at a level. Your team has just got an amazing beacon to follow. And it's why these statistics are what they are on this piece of paper today.
That's funny. You're right, though. You've got to set the bar and then raise it. And that's always been the struggle. We tease about it on my team. The work never ends. Once we reach that level, then we're raising it again because we know we can and we know we should. And it's the right thing to do. And I don't know, there's nothing more fulfilling to me than to know that I'm helping someone else and it's making a difference. And I do it not by my hands-on care in the exam rooms or the dental laboratory. I do it through my staff and setting the stage and making sure that they understand the expectations, because it's so critical that healthcare isn't just what happens in the exam room. It starts way before, and with the facilities and with the customer service and with the availability of services. And mind you, we have our warts, as I say. We have things we have to work on, but that's what makes us human. And and that's just how it is, and that's what will keep us employed, right? We're just going to keep chugging along and keep looking for more unmet need and keep improving the product, which is our service to our patients and community.
Well, I promised that this was going to be well worth the wait, and I feel like we could do this multiple times. So I think the only thing on my notes that we did not mention today is, in addition to Women in Business Month, it also happens to be Breast Cancer Awareness Month. And your team today is on what you sent me in an email is your pink out. So tell us what pink out is. I wore my pink shirt today. I hate to tell you, I only have one. So this is it. You got the one shirt that is in my closet that's pink. So what is a pink out at Lorain County Health and Dentistry?
So this is the fun part about healthcare, because as I always say, healthcare is such serious work, truly, especially on the front lines for the clinicians. And so it's fun when we can inject a useful message, if you will, a reminder to women. It's Breast Cancer Awareness Month, so prevention is key, absolutely key. Please get a mammogram if you're due. Remind somebody else too. We'll help with that. We don't actually do them here, but we give access to them through Mercy Hospital. We're happy to help. But yeah, so if you wear pink, you can wear blue jeans. And, in healthcare, that's kind of unusual. We don't get to do that a whole lot. So this year we decided to not just pick one day, but to do the whole month. So people can wear pink every day. And I'll tell you something, I had about 2 pink outfits too at the start of October, but I found a few items on sale and I have more pink now in my wardrobe. And I've got to set the stage, right? I lead the team. So every day I'm in pink. My coffee mug is pink. Everything's pink. So it's fun. And I'm so glad you went along with it. You're a good sport.
I love
I
it. I
appreciate
love
it.
it so much. And yes, I am a huge advocate. Go get your mammograms. And even when you need them early, go get them. So for
And
sure.
you know
For
what,
sure.
Kat? The thing is, when the patients come in, they see all of this pink. We have pink balloon towers, we have pink signs in all of our mulch beds outside the main entrances of our health center sites. It starts the conversation, and that's
Amen.
where it's just that we take it from there. Just start the conversation. That's
Yeah,
it.
and I think it's, like we say it here, be your own best student.
That's right.
You can only tell people so much until they see you actually doing it. It's why we do this podcast.
Yeah,
I don't need you to be a professor of some crazy thing. I need you to tell me how you got there, how you took that parallel move
yeah,
and said, you know what, I think I can do this one thing maybe. And
yeah,
bam, look at you now.
yeah. There you go.
Because it inspires. Obviously, you're inspiring people all over the place every day in what you do, but now other people can hear you do this and inspire them to maybe apply for the job that's just
Absolutely.
parallel. And
Yes.
I think that's amazing. So congratulations. All right, so Stephanie, tell people a couple of things. First of all, how would they be able to follow you in your leadership? And if there's a doctor out there that's interested in maybe learning about coming to work for you,
Sure.
or a patient that's maybe in need of your services and all that's available, I would just encourage you, if you are a patient and you are in any kind of question, reach out and ask, because the likelihood that they do it is really high. So how does anyone reach out to the clinic or maybe follow you for just some amazing inspiration?
Sure. So if there's anyone out there that needs healthcare, needs good healthcare, gosh, come to us. We'd be happy to provide that for you. And by the way, you don't have to live in Lorain County to access our services. So, and we have a lot of people who don't live in Lorain County, actually. So you would just call up 240-1655. That's area code 440-240-1655. It's our centralized call center. If there's a physician, nurse practitioner, dentist, dental hygienist, any number of support staff, nurse, front desk, call center, we have on our website job postings. It says join our team on our homepage. So just open our website. It's Lorain Health dentistry.org. So www.lorrainehealth-dentistry.org.
Okay, awesome. And we'll make sure that all of that ends up in the show notes as well. So you have any questions or anything, you can find all of that information
Appreciate that.
down
Thank
below.
you.
Stephanie, you are just a breath of fresh air. And like I said, I had a conversation with the chairman of your board coming up to this, and he's just so complimentary of you. And I think that if I didn't say it enough, you are leaving a legacy behind you that will reach generations. And I'm proud of you just having had this
Oh,
conversation, but I know your board is proud of you and
thank
your
you.
people, and you are a unique leader. And unsung
Yeah.
is maybe not enough of a word. So
Oh, but may I just say, and I appreciate that, but I could never have done this alone. It truly is the work of the team, my board, in a nonprofit that's so critical to have a CEO and a board that work well together. We respect each other. We don't always agree on things, but it always comes back to the mission and to the need, and what's truly doable. And then we set off on it. So I, I I really am uncomfortable being in the limelight. It's not just me, but thank you. I do appreciate that we've made an impact on the community's health and in ways that we can measure. It's amazing.
well, you're a natural. You did fantastic today. We tell everybody
Thank
to
you.
take just a little bit of time to breathe life in, and we'll see everybody on the next show.
Thank you.